This is Xiaoyan come from Zhongshan Office Center, Sangyuan University. Today, I would like to talk about basic facts of this disease in China, including its epidemiology, demography, genotype, diagnosis, and treatment status. As we talked a lot today, Leber hereditary optic neuropathy (LHON) is a maternally inherited mitochondrial disease that specifically targets the retinal ganglion cells by reducing their ability to produce enough energy to sustain. It was first identified as an independent genetic disorder in 1871 by the German ophthalmologist Theodor Leber, to whom it was named. This disease generally affects from children to young adults with a rapid, painless, bilateral loss of central vision. The prevalence of the disease varied a lot. Basically, it is a rare disease. In northeast England, 1 out of 8,500 individuals were found to have a pathogenic LHON causing variant. However, only 3.22 per 100,000 subjects had experienced vision loss. Fairly similar figures, which is around 2 per 100,000 populations, have been reported in the other regions, including USA, Europe, and Japan. Unfortunately, so far, there are no systemic epidemiology data available in China. It is reported there are about 126,000 potential patients with LHON in China. Thus, we expect more estimated patients in China. Fortunately, we do have two studied in the past 2 decades. The first one is from ZOC, where I am now working for. The biggest eye center in China by my teacher, Professor Zhang Qingjiu. This study was published in 2006, including more than 900 LHON probants. Most of them are from southern, eastern, and central China. And the second one, with large sample, is from Wenzhou Eye Center, another one of the biggest eye center in China by Professor Qu Jia, published in 2015, including more than 1,200 patients recruited from eye clinics across 29 provinces. Since the patients are from nationwide, we believe these two studies are very representative to LHO populations in China. Thanks to these two great studies, we have the opportunity to look into the demography and the genotype of this disease in China. Let's take a look about the demography. We are talking about the age and gender. Globally, the gender ratio of patients is about 3:1. The mean age of onset was 26 years old, with a significant peak of symptom onset in young men. However, the results of 2 Chinese studies showed that the average onset age of this disease was only 18 years old. The majority of them was between 10 to 29 years old, which is younger when compared with the global. The male to female ratio is much higher. It is about 2.6 to 5.27 to 1. Interestingly, about the onset peak, we could see a significant onset peak in women in China study, which is about 20 years old here, but the woman has no onset peak globally like this. It is very flat. The underlying reason was not clear now. Thus, briefly, we suggest a younger onset age with more males LHO patients in China. About the genotype of this disease, as we all know, 11778G2A, 14484T2C, and 3460G2A are the most common 3 mitochondrial DNA point mutations in this disease. These mutations could explain around 90% of these patients in the Caucasian population. Similarly, these three mutations were also found in Chinese populations, but only explain 35% of the cases. Variants 11778G2A and 3460G2A are associated with significant impairment in vision and poor visual recovery, but variant 14484T2C is associated with the best long-term visual outcome. Moreover, the Wenzhou study found a new mutation, that is 10680G2A, in about 0.4 patients. So that is quite different between the Chinese population and the global population. When we look into the proportion of the mutations among the three mutations, 11778 accounts for about 50 to 70% in global populations, but in China, it is much higher, which can reach about 90%. 14484 mutation is less common in Asian populations, accounts for only around 9%, which is lower than that. 17% in global populations. The mutation 3460 side mutation is very rare in Chinese patients. Thus, we have a bad news and a good one. The bad one is that there are more severe genotype with 11778 in China, but the good one is that it means now more LHON patients become treatable. The visual acuity at onset of this disease and the visual recovery of patients with 14484 T2C mutation are significantly better than those of patients with 11778. Half of the 14484 experience a favorable visual recovery in both China and global. However, even within the 11778 mutation, the visual recovery rate is even lower in China when compared to the global. In a meta-analysis, the visual function information in about 700 individuals with 11778 variant, the visual recovery occurred in about 14% of affected individuals of all ages and 11% of those aged 15 or older. However, the visual recovery occurred in only about 7% patients in China, so we could say very low spontaneous recovery rate was seen in 11778 in China. LHON could bring more mental burden on patients and families, compromising the quality of life a lot. The results of the DASS-21 scale showed that more than half of the patients showed psychological problems, such as depression, anxiety, and stress among them. Depression was the most serious problem, and the portion of people with moderate to severe, extremely severe depression, anxiety, and stress was about 55%, 45%, and 35%, respectively. We now talk about the diagnosis. The diagnosis of LHON, I believe, is still challenging nationwide and worldwide due to the rarity nature of this disease. It is not surprising. There are some, I believe there is a lot of misdiagnosis and underdiagnosis. So that's why we need a consensus or standards. Consensus of this disease has been released in 2019, led by Professor Wang Yingli from Chongren Eye Center, the same center with Professor Zhang. In this consensus, diagnostic strategies was suggested. First of all, we began with symptoms. This disease generally affects boy or young adult males with rapid, painless bilateral vision loss. The patient might complain color problems. Secondly, multiple examinations could be performed. Visual field testing shows an enlarging dense central scotoma OCT shows thinner RNFL, particularly in the papular module bundle. Then, neurologic abnormalities such as postural tremor, peripheral neuropathy, non-specific myopathy, and movement disorders have been reported to be common in individuals with this disease than in the general population. Some individuals with this disease, usually women, may also develop a multiple sclerosis-like illness. After the clinical diagnosis, the genetic diagnosis is highly recommended according to the consensus before we initiate the treatment. In fact, 3 steps could be used. Step 1, targeted mitochondrial DNA analysis for 3 most common pathologic variants. Since these 3 was observed in approximately 90% of the individuals with LHON, so these steps should be performed first. Step 2. If targeted testing did not identify a pathologic variant, the clinical suspicion of this disease remains high, then complete mitochondrial DNA sequencing may be considered. Step 3. WES should be considered if the reason still was not identified, but I recommend the doctors should look back to the clinical data and recheck the patients to make sure there are nothing ignored. Before approaching to the treatment, do not forget to do the registrations. In 2018, LHON is listed as one of the most important diseases in the rare disease catalog. In 2019, China Rare Disease Collaborative Network, led by the Chinese Healthy Commission, was launched. Her mission is to explore the knowledge, facilitate the early diagnosis and management, create more treatment opportunities for rare disease. This network, CRDCN, enrolled more than 300 hospitals, including the referral hospitals and the community hospitals in China, as members. So it is a big system. So we could say there are a lot of work have already been done to improve the timely diagnosis of LHON. In fact, we are proud and happy to see there are significantly improvement in the diagnosis and management of this disease. All of these, the clinical, genetical diagnosis, and the registration system, are all critical to the treatment. I would like to move on treatment now. So far, the treatment of affected individuals with LHON remains mostly supportive. It includes provision of visual aids, occupational rehabilitation, and the registration with the relevant social services. We prescribed the patients with vitamin B12, vitamin C, and also Q10. And in addition, we have Chinese traditional medicine and acupuncture. However, there are no evidence-based study of TCM in this disease so far. Currently, antioxidant is the most common drug, for example, idebenone, with a suggested dosage, a very higher dosage, 900 milligrams per day. The current study of evidence indicates some visual benefits in a subgroup of affected individuals treated with this medicine, particularly those treated within the first year of onset of vision loss. We use idebsone to treat these kind of patients in China, but challenges remains since idebsone was not being approved for the LHON patients in China. Currently, it is labeled to treat the patients with some traumatic brain injury, chronic vascular disease. The suggested dose in this kind of patients is only 30 milligrams per day. Thus, for the LHON patients, 30 pills per day is needed. That is really too much. So, in fact, this drug is not served as a routine in our clinical practice. Fortunately, LHON gene therapy research have been initiated in China 14 years ago, that is, in 2008. At present, we now have 2 gene therapy drugs for LHON, that is NFS01 and NFS02. They are both under clinical trial phase. We have the results from the IIT 1 to 3 and also phase 1 and 2 trials. The preliminary results showed that this drug is effective and safe for LHON. First, there are no serious adverse events in all these 4 studies. Second, the majority of the patients showed significant improvement of 3 lines in BCVA. Third, we also have the evidence of the long-term safety and effectiveness. The first patients have been followed up as long as 90 months. I believe Professor Zhang will talk about this in more detail. So, here is some take-home message for today. Basically, we believe in China, we have more potential patients with LHON. We have more males, more 11778 mutation. That means more treatable cases with less spontaneous recovery rate. The genetic diagnosis is available and also practical in China now. And we believe more potential patients will be benefited from genetic treatment. Thank you. Thank you for your listening.